I'm very excited that here we are, Breast Cancer Awareness Month, and we have some exciting news in breast cancer research for metastatic breast cancer patients. As you know, I've been telling the audience that I was recently diagnosed with metastatic breast cancer last February, and Dr. Timothy Pleward is here. He is a leader in metastatic breast cancer treatment. He is medical director of the Kuhn Center for Metastatic Breast Cancer at St. Luke's Hospital on the Plaza. Thank you and welcome. I'm glad you're here.
Thank you.
We were talking earlier when you walked in and you said this is breaking news for metastatic breast cancer patients, so tell all.
So for HER2 positive metastatic breast cancer patients, we just received word this morning of a trial that we are participating in with a new drug called tucatinib that added to standard Herceptin and oral chemotherapy actually improved overall survival in women with HER2 positive breast cancer. More importantly, brain metastases in HER2 positive breast cancer has been a difficult problem to treat, but these patients this drug actually works for brain metastases as well as it works for those who did not have brain metastases.
So does it go in there and just eat up the cancer, or does it block how does it work?
So it's a small molecule that actually gets into the brain as well as elsewhere in the body, and actually targets and blocks the HER2 protein, which is driving the growth of the cancer.
So I know a lot of people are wanting to write this down, so tell us the name of this drug again. There's some HER2 people positive out there that want to understand.
Tucatinib.
And so tucatinib.
Yeah.
T-E-C.
T-U.
Oh, T-U.
T-U-cat.
T-U-cat. Okay. So that's not hard. All right, so other drugs as well. We've had some discoveries here in the last, year or so?
Well, we made progress, I think, in the three major types of metastatic breast cancer.
Okay.
You know, we talked a little bit about HER2. There are probably two other drugs going to be approved next year as well for HER2 positive breast cancer. On the triple negative breast cancer front, we had the first immunotherapy that showed effectiveness in breast cancer. Immunotherapy has been very effective in other types of cancers. This is our first success in breast cancer. And then on the hormone receptor positive, those who are estrogen dependent, we've actually had a new drug that was approved just a few months ago that significantly improves the outcome for those patients by targeting a specific protein that's mutated in about 40% of patients with hormone receptor positive.
And so what can these women expect when they begin to take this drug? Is it a year or two later that it actually kind of eats up the cancer, or are you always going to be in treatment?
Well, with metastatic disease, a cure is extremely rare.
Right.
So the disease requires ongoing treatment, which may change as the cancer cells adapt to the current treatment.
Right.
So they may become resistant, and then you have to move on to a different treatment.
But it's nice that these new treatments are out there. So what's the name of this new drug that you said is really positive and showing great results?
In
immunotherapy.
Immunotherapy, it's atezolizumab.
Atezolizumab.
Right.
All right.
A mouthful.
I know, but we're glad that these are here. So these are some things that patients need to be talking with their physicians about.
Yes, and I think it emphasizes the importance of clinical trials because all of these advances come through clinical trials, which is something we're very focused on at the Kuhn Center.
Very good. All right, thanks so much for coming and for sharing that breaking news and research for metastatic breast cancer.